What's going on, everybody? John Stamper with Dental Cast Productions, and very excited today for our special guest. As many of you know that are part of the Connecticut State Dental Association, they have been putting on this awesome CE course program. You know, each month they've had just such great speakers from all over the country talking about super relative courses and things like that. So we wanted to make sure we came on here and highlighted all of these great doctors and all of the speakers that are part of this series. And I'm very, very excited today. We have coming all the way from Bellevue, Washington, such a beautiful part of the country, Dr. Steve Carstensen, who's with us, who is going to be presenting on March 11th from 9 a.m. to 3:30 at the Aqua Turf Club. Dr. Carstensen, thanks for joining us.
Well, thank you. Good to be with you, John.
All right. So before we get into both of your sessions, which look really exciting and quite honestly, very relevant with, I know a lot of things that people want to learn in dentistry right now around the airway and things like that. We'd love to have you share with everybody a little bit about your story and how you got to where you are.
Sure. I graduated from dental school a long time ago in 1983, but importantly, in 1989, I was studying down at the Pankey Institute, and I ran into a dentist named Keith Thornton out of Dallas. Well, Dr. Thornton is one of the pioneers of making appliances to help people breathe better at nighttime. And so he would talk to the dentist he was close to and say, man, you got to get into this. It's so exciting. And so I finally listened to him and started treating patients a year after that or so. And it is exciting. And as I carried on with my restorative career, I was doing more and more of this dental sleep medicine or appliance therapy. And as a teacher in the industry, I taught at Pankey, and now I teach in lots of places. I became aware that, gosh, the message I could bring is really about what dentists can do to make people healthier. And so I kind of aimed my practice that way, and pretty soon it took over my practice. And a few years ago now, I sold my dental practice to a young dentist, and then with a partner who sold her practice as well, we started Premier Sleep in Bellevue, Washington, where that's all we do is treat airway issues and TMD issues. Dental sleep medicine is kind of an older term now, but that's what we're still using for it. And as an educator and a clinician, and I've been bringing the message to the Pankey Institute, to Spear Education, to a couple of dental schools. And I'm also now kind of proud of this one. I'm the consultant to the American Dental Association on sleep-related breathing disorders. And so they reach out to me and ask me questions, and I get to bring in the clinical wisdom that now myself and some others have had after all these decades. And our mission is to get the practicing general dentist and the pediatric dentist to pay attention to airway issues, not just all the fine restorative care we can do, the kids work, the orthodontics, all those things. They're wonderful that we do, but there's an airway attached to all of those humans, and we can do something about that and make people much, much healthier at nighttime. And that does well for our restorative care as well.
Yeah, and I would have to think, like you mentioned, as being somewhat of an early pioneer with a lot of this, to see not only the explosive growth in so many doctors across the country taking an interest in this, wanting to learn more about it, but like you mentioned, what it's meant for the patients, right? What it's meant for all of those patients out there that struggle with this and maybe didn't know where to go. It's very exciting. So I love the story.
Yeah, the real reality is that we have tens of millions of people in the United States alone. There's 1 billion people worldwide. They just came out with that study. But there's tens of millions of Americans who have some kind of a sleep-related breathing disorder. There's only about 4,500, maybe 5,000 practicing board-certified sleep medicine physicians. Mm-hmm. So if those doctors are going to be the ones that are ultimately going to do our diagnosis, but what we need is a large part of the medical workforce to be looking for people at risk so we can get them on a pathway for better health. There's 190,000 dentists. And so if we can do what the ADA has helped us see as an important role through the policy statement from 2017, then what we can do is we can be part of that workforce, part of that medical oversight, part of the way we can get some of those tens of millions of Americans treated, and so get them sleeping better at night. And that's a powerful role for dentistry as a profession to take. individually in a practice, the dentist who starts to ask questions about sleep-related breathing disorders and provide therapies or pathways or recommendations, any role that they play, is going to get some great positive feedback from their patients. And that bodes well for the practice. It feels good as a practitioner, and it's wonderful for the team as well. So it's kind of an all-win situation when the dentist starts to think about airway issues.
Yeah, and I think that's a great segue into your AM session,
Yeah.
which is talking about airway therapy for the general dental team, like you
Right.
mentioned, the whole team being on board. So let's start there. Let's have you talk a little bit about some of the key takeaways from that course and what people can expect when they come.
Yeah, when we think about a patient who has a breathing disorder, we can call it snoring, we can call it sleep apnea. It doesn't really matter. It's because the diagnosis comes later. But if they
Mhm.
uh, outline or expose to the dental office some history that says, wow, there must be a risk of a problem here, then the dentist needs to know what to do with that. And the team needs to know how to interact with that so that there's an efficient pathway. It doesn't cost the practice a lot of time or money. It doesn't get in the way, basically.
Yep.
So we're going to go over the importance of asking the questions and why the patient should be sharing with the dental office that information. And then what does the dental office do with that information? How do they make it work for them? So we're going to talk about screeners. We're going to talk about the medical consequences of sleep-related breathing disorders. We're going to talk about how the whole team can be involved with the process and making sure that it feels like it's something that they should be asking about and doesn't feel uncomfortable for the team. Because we got to make sure we reduce barriers, make it easy, make it cost effective, all those positive things for a dental practice.
Yeah,
Then we're going to talk about, we're going to talk about some, once the patient gets screened and says, oh, you must be at risk, well, then there's a diagnosis process. Well, we can't have the dentist recommending a diagnosis without understanding what that process is like. So we'll talk about that as well.
Mhm. Yeah, and you mentioned it a little bit, but as you know, doctor, a lot of doctors will go to courses across the country on a topic that they're interested in, and be excited, come back to the practice, and want to talk to the team about it. And to your point, if the team doesn't understand, or like you mentioned, is not all bought in, it can be challenging, right? So I love the fact that you're addressing that. Getting everybody on board is important. And have you seen that? Have you seen that? And as you go around the country and speak and work with people, that there are more and more teams in addition to the doctors that are interested in offering this to the patients?
Yeah, I love it when there's a team member in any lecture I'm giving because it's true. It's been true for my entire dental career. Every dentist who hears this is going to recognize themselves that they go to a course and get excited and they come back and the team says, well, how are we going to make this work? Because they want to support the dentist, sure.
Right.
Well, what I'm going to do is I'm going to give key team development resources. We're going to talk about how to do a team meeting, some key things that the team can do so that the dentist can go back with action items that their staff can take over and do for them so that the team gets involved straight away.
Yeah, I love that. All right. So then as you move into the PM session, I love the title of this one. It's good to breathe well at any age, all the time. So very intrigued to talk about that session.
Oh, this is my favorite topic to talk about. I could talk about this for 3 days, much less a couple hours. And that is well, let's go back to the beginning. When they discovered sleep apnea, it was on older men in hospitals who weren't breathing. And that's where they could observe that really well. And so the disease was defined with those older men. And we have expanded now over the course of the last 40 years or so, which is all it's been for sleep medicine. We've expanded that to realize it could be older men, it could be older women, it could be middle-aged men and women as well. And obviously, every one of those 55-year-olds that are breathing badly at nighttime were at one time 5-year-olds.
Right.
So as we turn the clock back in time and look at those potential 5-year-olds, we realize, wow, they were set up for their old age years breathing problems when they were little. So if that's true, then what can we do when they're little? What can we do when they're growing? And obviously those kids have a plastic maxilla. It's growing, it's being shaped, it's being conformed to hold the teeth, which is what dentists think about the most, but it also supports the airway. So what my mission with this lecture and some other things I'm working on at the American Dental Association is to expand the scope of dentistry to include shaping the airway when kids are little. Because if they're 5, 6, 7 years old and we can get in there and do something important, then we should be able to turn them into 40, 50, and 60-year-olds with better airways. And as a consequence, we also get better teeth alignment too. So we get beautiful smiles, all the things dentists can do. But we want to help them breathe better through those years as well. There's a ton of benefits for that. So what I'm going to do in this lecture, I'm going to talk to the practices about how to talk to families, how to look at kids, how to ask questions, what questions to ask, and how to assess what the child's airway problems might be when they're in their single-digit growth years. And then if they want to intervene, how can they shape their interventions that way? Or how can they find the right orthodontist in their area to do that intervention? Who else do they talk to? Ear, nose, and throat doctors, all the things that we can do. Because children's airway, children's breathing, children's growth and development is really completely in the hands of dentists, because we're the only ones with a growth and development mindset. We're the only ones with a growth and development treatment plan for these kids. And so it's going to fall to dentistry to be the major players for kids' airways in those early digit years. We have the potential to be the deciding factor to make sure we grow these children into healthy adults. It's amazing the power we have. So I'm going to kick that off with and I only have about an hour and a half for that lecture. So it's going to be a pretty exciting hour and a half.
I love that. And you know what's so encouraging just hearing you talk about this? I mean, obviously it seems like there's been more and more attention, although it's been around for a long time, the oral systemic link, and people now truly buying into the science that, you know, what happens in a patient's mouth obviously is connected to the other parts of the body. And I think that's what excites me so much about this airway work that you have done, you know, so many things on and so many others are, because, you know, I think to myself, you know, having small children and them not sleeping well or them having problems, and how many parents out there a lot of times don't know what it could be. And so I think the fact that, you know, dentistry has really taken the lead on this to help them early in their years is just, it's very exciting, like you mentioned, and the education is what it's all about. And I think that's what's so important. Why I know the CSDA wanted to have you come on, and certainly I know it's a privilege to have you come out, but to have you share with everybody before this course, you know, of what you're going to talk about, the importance of that, so that they can, you know, block off time in their day. I know it's not always easy for a doctor to leave the office and to come down, you know, for a course. But I think something like this, like you mentioned, which is so important, not only for what could be for their practice, but for their patients, is definitely worth it. So, and anything in closing, you know, as you look forward to coming to Connecticut in March.
Yeah. Well, you talked about the doctor taking off time from practice. I mean, not to tout myself at all, but I'm flying all the way to the East Coast because I think this
yes,
so
exactly.
So,
Yeah.
so that's how I feel about it. And then I actually have a third segment that Connecticut asked me to talk about, and that is, since we're going to be working in the medical realm, of talking to other medical providers about their adult patients at risk and medical comorbidities. And then we're going to also be setting up these families to talk about their kids and what's going on with their airway. It actually becomes a requirement that we document what we're talking about differently than we're typically trained for in dental school. Right. And so they asked me to spend about an hour on medical documentation. So how do we write down the things that we are observing and communicate very well with our physician and other medical colleagues? Mm-hmm. These are kind of new skills that make the dentist a lot more comfortable in exchanging information with the other parts of medicine. You know, that's part of what we have to do with this, because as we think about what a general dental office does, typically they're focused on the dentistry because we're the experts and that's what we should be doing. Right. And then we think about other medical providers and surgeons, for example, oral surgeons, they do medicine. But what does the general dentist do in medicine? Well, not too much. And so if we think about airway issues, sleep issues, growth and development issues, this is where we get closer and closer to our medical colleagues. We interact with them at a deeper, more regular, more important level. And to be comfortable with that, we have to know how to talk their language. And I'm going to spend about an hour or so talking about medical documentation so that the offices can be comfortable with that as well. So I'm excited about all three parts of that. You know, again, I could expand all of those. So we'll get a taste of it all. But I'm sure that I'm going to send people away with new tools that they can use in their practice right away to make their patients healthier, to give their team something exciting to do and to make their practice actually more important in their community than it already is with their fine restorative and preventive dental work. So it's a fun message. I love giving it.
Yeah, I love that. And I think, like you mentioned, just that little hour at the end, the medical notes, kind of putting a bow around the whole, package of the course. Like you said, it's they could be getting exciting about doing a lot of the procedures. A lot of them are, but then that documenting piece is certainly such a big piece, and we're seeing that more, right? We're seeing
Right.
a lot of courses out there on medical documentation and benefits and things like that. So very, very important to kind of wrap out the day.
Yeah.
All right. Well, thank you so much. I mean, this has
Sure.
been a true pleasure. And again, everybody, March 11th from 9 a.m. to 3:30, Aqua Turf Club. Wherever you're watching this, whether it be on social media or an email, all the registration information, the link to go ahead and register for Dr. Carstensen's course will be in that link. So please join him. Super important content. Looks like what's going to be a wonderful day of continuing education. And Dr. Carstensen, thank you so much for taking your time today.
You bet, John. I look forward to being in Connecticut. I'm going to have a great time that day. I know everybody in the room will walk away with something good, and I hope that I'll see some friends that I know from out there. So it's going to be a fun day. I hope you'll spend your time with us on the 11th.
Awesome. All right. Well, thanks again, and we'll see you on March 11th, everybody.
Hey.
All right. Take care.